So we're talking about we've spoken so much about avascular necrosis. So we're trying to talk about the different types we have. So for the different types we have the traumatic one, we have the non-traumatic one. So traumatic one, of course, you should be knowing that there's avascular necrosis, that's like blood supply to the hip is kind of like being disrupted, and this is because of an injury, a trauma, an accident. Then non-traumatic, yes, the blood supply to the hip joint is kind of like being disrupted, but it was not due to what? An injury, physical injury. Do you understand? So for the different types, we said that first, introducing the avascular necrosis is the death of bone tissue, and this is because the blood supply has been tampered with. Okay, it can be triggered by traumatic, that's injury, or non-traumatic. So for the traumatic one, there's kind of like direct injury to the bone or joint. All right, common causes: hip dislocation, femoral neck fractures, joint trauma. So anything that is damaging the blood vessel, all right, is a traumatic cause. Okay, so typical features is usually unilateral, one side, often seen in younger patients. Risk increases with delay, reduction of dislocation of poor fracture healing, okay, and all of that. Do you understand? So hip dislocation is like the primary cause. Then non-traumatic, you're having issues with the blood supply to the hip joints, but it's not because of an injury. Do you understand? So common causes is you are using corticosteroids for a very long time, alcohol abuse, sickle cell disease, systemic lupus erythematosus, you have HIV, you have Gaucher's disease, hyperlipidemia, you smoke, or many other things. Alright. So typical features, the one that is not due to injury is usually affect both sides. Yes, because it's systemic issue, so it comes on both sides. May progress silently until advanced stages, associated with fatty deposits that block blood vessels. Okay, examples is what? Avascular necrosis of both femoral heads in a patient with lupus, or the patient has been using steroid therapies for a very long time.